Hello everyone, it's my pleasure to meet you. I hope you and your country win the war against the threatening enemy, COVID-19. My name is Lee Han-kyung, Director General of the Social Disaster Response Policy Bureau, the Ministry of the Interior and Safety, Korea. This is my first time to give you a lecture. Today I would like to talk about disaster response governance in Korea. I hope that we could build and maintain long-lasting relationships by taking this as an opportunity. This lecture focuses on governance for disaster risk management in Korea around COVID-19. Amid this fatal national disaster, we look through the way how the Korea government respond to COVID-19 by focusing on CDSCH. Especially the audience can build an understanding of critical factors in order to handle with a disaster crisis quickly with digital technologies as well as reliable infrastructures regularly and physically. This course can be of great help in preventing and managing the disaster. The course mainly consists of disaster response system in Korea, roles and responsibilities of Central Disaster and Safety Countermeasure Headquarters, infrastructure to help Korea respond to COVID-19, and measures to respond to COVID-19 using digital technologies. The course aims to build an understanding of governance to manage the disaster risk effectively, figure out which infrastructures are fundamental to support for prevention and response to the national disaster, and understand how Korea utilizes digital technologies to cope with the disaster. Let's take a look at the map. As you can see, COVID-19 swept through the world. People in every part of the world are doing their best to fight against the virus, but there is a long way to go. We could say that the entire human race is fighting the World War III. As we work for the government, we all should serve as soldiers to defeat COVID-19 and take back the green earth. Korea's disaster response system varies slightly depending on the type of disaster. Then let's find out about Korea's COVID-19 response system that is currently in operation. With regard to response to COVID-19, the Prime Minister serves as the head of the Central Headquarters, CDSCH. This implies many advantages. I will explain the details later. The Ministry of Health and Welfare is in charge of the prevention and control of infectious disease as CDMH. Korea Centers for Disease Control and Prevention, Kcdc, is in charge of the quarantine headquarters, CDCH. Ministry of the Interior and Safety that I work for installs a pan-governmental support group along with related agencies of the central government to assist the activities of CDMH. Local government plays an important role as they provide services to nearby citizens in need. They install local disaster and safety countermeasure units in their region to carry out disease control activities on site. That is how the COVID-19 response governance framework of the Korean government is structured. In a nutshell, the framework enables all administrative agencies across the country to cooperate together to act as a single organization led by the Prime Minister. Like an army, all units are systematically organized to defeat and respond to the disease effectively. The risk alert level system stays on attention at the outbreak of COVID-19 in China, and Kcdc immediately begins to operate response team, monitors risk symptoms while maintaining its response capacity. When the outbreak of disease is detected in Korea, the alert level is elevated to caution. Kcdc installs and operates CDCH disinfect at the site and initiate the infrastructure to control the disease. When restrictive transmission of the disease is detected, the alert level is upgraded to alert. Ministry of Health and Welfare and corresponding local government install and operate CDMH and LDSCH local headquarters respectively. If it is expected that the situation would get worse after detecting risk symptoms, Ministry of the Interior and Safety begins to operate PCSH. If the disease spreads to local communities or across the country, the operation of CDSCH central headquarters is initiated. As you can see, the Korean government implements a strategy to expand its response structure according to the risk alert level. The government operates the response structure depending on the scope and severity of the risk. From now on, we will explore the specific roles of each agency in the response system. The first major agency to look at is CDCS or Kcdc. It has expertise and plays a key role in dealing with infectious disease. There are three main roles of Kcdc: supervision of infectious disease prevention and control activities, infectious disease monitoring system operation, and public relations. With regard to the supervision of infectious disease prevention and control, Kcdc shares the information of confirmed cases, support the supplies required to prevent and control the disease, and operate the risk assessment meeting and expert council. As for infectious disease monitoring system operation, Kcdc operates rapid response team at site, conduct epidemiological investigations, and manages the patient and those having contact with them. Communicating with the public is also a critical role of Kcdc, as proactive support of the public is the key to successful prevention and control of the disease. CDMH generally oversees the situation on the control and management of infectious disease risk. Among the functions of Ministry of Health and Welfare, Kcdc has been established and placed under each wing to manage infectious disease. Therefore, Ministry of Health and Welfare support Kcdc to carry out related activities. Also, Ministry of Health and Welfare issues the National Infectious Disease Risk Alert, mobilize and allocate hospitals and medical personnel. Local government are field players that carry out activities to prevent and control the disease at site. They conduct epidemiological investigations with the support from the central government, operate temporary treatment centers and temporary residential facilities, manage people under quarantine, and transport and support the patient, etc. In fact, the creative and active role of local government determine the success or failure of national defense. A good example is the drive-through testing created by local government. A massive disaster like COVID-19 is hard to overcome only with capabilities of disease control authorities. The Ministry of the Interior and Safety, where I work, plays a role in supporting response capabilities of local governments by helping them and working together with a number of central ministries. In a word, it serves as a facilitator of great governance. In addition, it is responsible for multi-ministerial participation projects that are difficult for quarantine authorities to handle. Examples include the operation of quarantine facilities and temporary treatment centers. Central Headquarters meeting is a unique governance framework that is found only in Korea. It is a nationwide meeting group presided by the Prime Minister in charge of each administrative department and agency, with the attendance of every central agency, metropolitan, province, city, district. Holding such a meeting was possible as the country is connected with high-speed communication networks. In the Central Headquarters meeting, the participants deal with major policies of the central government as well as detailed items on site on COVID-19. Critical issues nationwide are discussed representatives of related ministries provide alternatives, discussions are made and determined in final. We can witness the well-organized governance framework consists of the central government and local government and how it works vividly each day in Korea. Korea has experienced numerous natural social disasters, and the country has established the legal infrastructure during the process of overcoming such crises. First, the country enacted Framework Act on the Management of Disaster and Safety as its basic framework and tool for effective disaster management. Infectious Disease Control and Prevention Act is established based on lessons learned from MERS in 2015. Compared to other countries, we do not have enough number of doctors or nurses to respond to COVID-19. However, the government worked hard to reduce the burden on them through the governance providing a series of measures. Military personnel is a peculiar type of human resources existing in Korea. There are doctors and nurses among the military personnel, and they also conduct a critical role to provide medical services in need, if there are insufficient number of medical staff. Also, administrative staff of government conduct a critical role to manage temporary treatment centers and those under self-quarantine and inspect high-risk facilities. With regard to physical infrastructure, we have quite a large number of hospital beds. However, we have installed and operated temporary treatment centers to separate them from ordinary treatment and healthcare services for other patients. Screening stations have evolved from conventional concept to various models such as drive-through, walk-through, etc. There are three requirements to establish and operate an effective governance framework to respond to COVID-19. First, we need mutual citizenship that cares for the safety of me and my family as well as our neighbors. Koreans have a strong bond or a sense of unity on earth originated from the experience of overcoming numerous adversities. Such matured citizenship can be found from owners of singing rooms who voluntarily decide to suspend their business or people who encourage or support Koreans entering from countries with many confirmed cases. Second, we do not have many doctors or nurses, but they dedicated themselves regardless of their field of specialization to overcome the crisis that came from rapid increase of confirmed cases. Citizens launched a thank you challenge by the social media to pay gratitude to them. The picture below shows the meaning of comforting and encouraging each other. Third, the Prime Minister and almost all government employees are working on weekend to fight against COVID-19, although it is not their main areas of work. It would not be possible with a sense of responsibility working for the public. I believe that citizens and healthcare workers and government employees are all heroes and heroines in our society. Surveillance, testing, tracing, treatment, and quarantine are key elements of the Korean quarantine system. First, we focused on prompt identification of confirmed cases. When we find any confirmed cases, we analyze the chain of transmission and source of infection and take actions to stop the spread of the disease based on the information gathered. Those who are confirmed with COVID-19 are isolated in temporary treatment centers to receive medical treatment, and people having contact with them are isolated or undergo active monitoring depending on the severity of symptoms. We are providing public guidelines to follow as an individual or as a collective group, and local government conduct education and promotional activities to reinforce responsive capabilities of their communities. The COVID-19 response process in Korea is not greatly different from that of other countries. However, Korea tries to carry out this process more quickly and actively. Korea has established a solid and concrete governance structure to respond to COVID-19 and implemented various measures based on the framework. As for the government, Ministry of the Interior and Safety serves the role of governance facilitator. Ministry of the Interior and Safety installs and operates pan-governmental countermeasure support headquarters to provide administrative support if needed so that related agencies promptly cooperate and deploy its personnel at site to assist activities related to COVID-19 response. For instance, Ministry of the Interior and Safety deployed a pan-governmental unit to Daegu. When the city and nearby regions were witnessing an increasing number of confirmed cases in order to support and provide special measures. During the process, the Prime Minister led the unit directly to solve problems on site. In addition, Ministry of the Interior and Safety is carrying out various activities, including the operation of temporary treatment centers and temporary residential facilities, management of people under self-quarantine, and blind spot inspections. From now on, I will take some examples of what Ministry of the Interior and Safety has done as a governance facilitator. Operation of temporary treatment center is one of the main activities of Ministry of the Interior and Safety. The decision to install and operate temporary treatment centers was made as more than 2,000 patients had to stay at home due to a lack of hospital bed, with a rapid increase of confirmed cases in Daegu and nearby areas. We had to find an alternative urgently. At that time, cases in China provided an important clue. It confirmed that approximately 80% of patients had mild symptoms and they did not require hospitalization. As more temporary treatment centers were installed and operated, all patients staying at home were transported to quarantine locations and hospitals were able to conduct their business as usual. Likewise, the installation of temporary treatment centers was not come from a thorough plan. Rather, it was based on an urgent decision to find places to admit a rapidly increasing number of patients. However, Ministry of the Interior and Safety was able to run the centers without biggest obstacles by using cooperative relations with other ministries and local government. It was a great governance. I will briefly explain to you about the operation of temporary treatment centers by looking at the pictures. Before we move on to discuss about the complex process and details, first the government secured facilities to install the temporary treatment centers. Those facilities include both public building and those from private sector. Samsung provided this. There are a lot of works to prepare for the operation of temporary treatment centers, as they have to switch their functions to how to such facilities are built for in the first place. The process of operating temporary treatment centers should be precise and thorough, as we have to ensure the comfort of individuals during their stay and take measures according to their changing symptoms. Medical staff and administrative support staff frequently discuss with each other and seek ways for successful operation of temporary treatment center. It is true that people enter the temporary treatment center with a heavy heart. Operating staff and medical workers feel fulfilled to see those admitted to the center are recovered from the disease and return home with a smile. Temporary Treatment Center Operating Group, jointly led by Ministry of the Interior and Safety and Ministry of Health and Welfare consists of 5 teams with the participation of 7 government agencies. There are more members working for the operating group than usual, as the centers are installed out of urgency. Doctors and nurses are responsible for providing medical treatment to the patient, along with the Ministry of Health and Welfare. Medical staff and waste treatment are mostly handled by the private sector. The main objective of the operating unit is to help the patient stay comfortably in the center, recover from the disease, and return home. Well, let me briefly explain about the operating guidelines of temporary treatment centers in Korea, as you may operate your own in your country. We recommend you consider regional distribution of temporary treatment centers based on the population size, if possible. In the case of Korea, public facilities of central local government were the most ideal destination for temporary treatment centers to secure such facilities promptly. If you have no experience of operating such center, it would be better for the central government and agents in charge of healthcare in particular to take the lead for stable operation. However, allowing local government to participate in the operation and gradually shifting the role to them can be a way for efficient operation of multiple centers. We also recommend you utilize local medical talents where such center is installed if possible. Lastly, an agency playing a role similar to that of Kcdc should provide operating guidelines on temporary treatment center in order to increase the efficiency and guarantee stable operation. Make sure that all operating and medical personnel should work in a shift after serving for certain hours to operate such facilities for a long time. Daegu faced the most dangerous situation in Korea, as the city had more than 6,000 confirmed cases in a short period of time. About 45% of them admitted to temporary treatment centers. This meant that temporary treatment centers played a critical role to prevent the collapse of medical system in Daegu and Gyeongbuk region. I assure you that the case in Daegu can be a reference example if your country faces a similar situation. In Korea, people suspected of infection are forced to stay in separate spaces at home for 14 days. Managing those under self-quarantine is one of the main duties of Ministry of the Interior and Safety regarding COVID-19 response. When self-quarantine of an individual is determined, local government assigns a case officer as manager, and the self-quarantine notice is sent to the person. The assigned officer continues to monitor the status of the individual on whether or not she complies with the guidelines. The self-quarantine order is released after 14 days if there is nothing significant to report. People under self-quarantine should install the self-quarantine safety protection app to monitor whether or not they comply with the guidelines. All foreign entrants are required to install the app, and Korean residents should install it with consent. This app sends an auto notice on the health condition of people under self-quarantine to the designated case officer. It also sends an alert if the person leaves the designated location. If fever or any abnormal symptoms are detected, the officer transports the person to hospital or take other actions for her safety. Now I will explain to you a series of responses using digital technologies. We use CBS to promptly spread the information on the outbreak of a disaster. If there are any confirmed cases of COVID-19, we send the message to nearby citizens promptly to help them not to visit places where people confirmed with the disease visited for having contact, and advise people who have already visited such places or contacted with COVID-19 patients to undergo testing for diagnosis or not to have contact with others. EDBS is designed to promptly provide the information on disaster to the public through TV with many viewers. The biggest advantage of EDBS is in that it can provide more information than CBS. Safety reporting allows people to report on items that may lead to a disaster to the government easily by using a mobile app. People can report behaviors or facilities violating the disease prevention control guidelines or suggest any policy ideas with regard to COVID-19 response. Disaster management is the key to saving lives. We all are fighting a war against COVID-19. We can conquer COVID-19 by cooperating together. Our hope is to take back the beautiful green earth. Thank you for listening.